Okay, so this is a continuation of the first video where it was discussed about doing all the appropriate checks, drawing up the medications. All of that has been done. This video is strictly about the landmarks themselves. I've already ejected the liquid from the syringes because in the skill you don't inject liquid into the mannequins. And everything's been double checked. I've identified my patient, provided for privacy. I've done all the general safety practices that we need to do, and this is about finding the landmarks. So the first landmark that we're going to find is the vastus lateralis. Of course, I would put on my gloves. I've assessed my patient, if any of these are pain medications. All of that has been done. So we've talked to you about numerous ways that are possible to hold your alcohol swab. We've demonstrated that you can put it between your fingers. We've also demonstrated that some individuals will keep it on the skin after they clean their site. So in order to find this first landmark, I'm going to lay my alcohol down there for a minute. This is the vastus lateralis. And for the vastus lateralis, we are going to make sure that the patient is flat. We're going to have their knee slightly flexed. That helps them to relax, or they can be sitting. And what you're going to do is you're going to place one hand above the knee, and you are going to place one hand below the greater trochanter. It's right there. And we are going to go into the lateral aspect middle third of the muscle. So if this is the center of the muscle, we're going to go over here on the lateral aspect just for a landmark. And we're going to give our injection in here. So I found my landmark. I'm going to take a clean alcohol swab. I'm going to clean in a circular motion. I am going to allow this to dry. I have my injection ready. I've let that dry. The patient knows what to expect. I'm going to put the bevel up on my syringe. Because this is not an immunization, I'm going to aspirate. You can see that I'm sort of resting my hand on the patient. For me, that gives a little bit more steadiness to the syringe. And then I just draw back and I dart. I aspirate. I don't get any blood. And I go ahead and very smoothly push that in and then cover my site. I'm going to not recap my needle inappropriately. Once I know that this is not bleeding, I can go ahead and put my patient back, let them relax, give them their call light, and get rid of my needle appropriately. Okay, another site that we can do is the ventrogluteal. I'll go ahead and get ready to do that. To do the ventrogluteal, we are going to get an alcohol swab. I'm going to put the patient in either a supine or a lateral position with their knees and their hips flexed. And what I'm going to do is I'm going to find that greater trochanter, and you can actually kind of feel that here on these mannequins. And I'm going to put my palm of my hand over the greater trochanter. I'm going to point my thumb towards the patient's groin, the index finger towards the anterior superior iliac spine, and on these mannequins, it's about right in there. You may be able to see that hump there. So towards the groin with the thumb, towards the anterior superior iliac spine, extend the middle finger back towards the iliac crest toward the butt, and then give the injection in the V that's formed by that middle finger and that index finger. So I'm going to clean this site, again in a circular motion. I'm going to allow that to dry. I'm going to go ahead and place my alcohol swab on my patient. I'm going to go ahead and uncap. And I'm going to go ahead, again, I steady my hand. I make sure that the bevel is up. And then I can dart by having my hand steadied like that, but you'll need to develop your own technique. Again, this is not an immunization, so I'm going to dart in. I'm going to aspirate. I don't get any blood. And I'm going to go ahead and push smoothly in, replace, hold pressure there for just a minute or a few seconds. Generally, if you do this correctly, you won't have a lot of blood. And then I'm going to lift that up and then go ahead with my patient and make sure that they're back in the appropriate position, call, line, and reach, and all those other safety practices. I'm going to go ahead now. We're going to do one more intramuscular. And for that intramuscular, we're going to use the deltoid. And for the deltoid, we're going to palpate the lower edge of the acromion process, which is right up here at the top of the arm. And you have two techniques that you can do. You can either go to the acromion process, form the base of your triangle, which will go in this direction. So you have your base. And what you can do is imagine drawing a triangle there, and then you would inject into the center of that triangle. Generally, it's about an inch or two below the acromion process. So I've done that. I've palpated the acromion process. I've drawn that imaginary line. Now this is odd because I wouldn't be standing with the patient this way. I'm going to be cleaning. I'm going to go ahead and place that alcohol swab there. I can still see my site. I still see my site. I'm going to steady my hand. This is an immunization. We're going to say this is flu because generally this is where we get our flus. So we're not going to aspirate on this one. So I'm going to get my bevel up. I'm going to inject in, and then I'm going to slowly push that in and pull it out. Hold pressure for just a few minutes. Lift up, look, everything's fine. Go ahead and recap my needle appropriately. Make sure I don't put my finger down here on the tip when I recap, and that takes care of all the IM injections. The next thing that I'm going to do, well, since I have the arm, I'm going to go ahead and do this. I'm going to go ahead and talk to you about the sub-Q. Sub-Qs are either given in the abdomen, 2 inches away from the umbilicus, or they're given generally in the fatty pad on the back of the arm. So we're going to go ahead and do that since we have this arm so conveniently located. And we are going to give our injection. This is our patient here. Obviously they're antecubital, and we're going to give it right back here. So I'm going to roll this over so you can see that. I'm going to pinch up. Remember, we said that if you can pinch more than 2 inches, you're going to go in at a 90 degrees, and if you can only pinch an inch, you go in at a 45 degree. So I'm going to say I'm pinching 2 inches. I'm going to clean in a circular motion. I have this skin pinched up. I am giving insulin. I am giving 15 units of insulin. I'll go ahead and remove the cap. I still see my site. Believe it or not, even on these tiny needles, there's a bevel up. I'm going to pinch in. I do not have to aspirate on sub-Q. I'm going to dart at a 90-degree angle, give it, and guess my alcohol swab, I'm going to hold that there. Generally, I would have left that on the skin, or actually maybe grabbed a piece of gauze if I had that available. And that's it. Generally, with those sub-Qs, you don't necessarily get blood. And then we are going to give a sub-Q in the abdomen. I'm going to kind of turn this mannequin a little bit so you can see this. We want to be about 2 inches out from the umbilicus. That has to do with absorption issues, and I'm going to give it down here. If patients have been getting sub-Q injections, whether it's heparin or any other type of blood thinner, Lovenox, you may see some bruising. We do recommend that you don't rub. I know a lot of times after injections people will rub. But here, if we're given a blood thinner, we do not want to rub because it increases the incidence of bruising. So I am going to give a sub-Q injection of, we'll say, heparin. I'm going to clean again in a circular motion. I should be approximately 2 inches out. And I'm going to pinch the skin up. I laid my alcohol down, so let me get another clean one. I'm going to clean again. Lay my alcohol here. I'm going to pinch the skin up. I'm going to inject in. Give it, pull away, hold pressure. These take just a little bit of time. I mean, they're very quick. It's not something you want to linger with. And then you should be fine. So that takes care of the sub-Q in the abdomen. And then the last thing that we want to demonstrate is to do the intradermal. This is going to be in the forearm. Generally, we say these lie like this. And we are going to inject. We're going to find our landmark. I generally go 1 inch above, 1 inch below the elbow or the bend in your arm. Go one inch, 1 hand breadth below that, and then 1 hand breadth above the wrist. So we're going to be in about right here in the center. I'm going to turn this direction, kind of lay it over a little bit clean. Hold on to that. I have to let go for just a second. You hope that doesn't happen. Put my cap down. Again, put the bevel up. I'm going to hold it a 5 to 15 degree angle, so I'm going to be really, I'm going to turn this. I'm going to be pretty flat against that. So you are not going to see a bleb because I don't have any fluid in here. I'm going to inject that. Put just a little pressure. Do not rub this. Don't push real hard because you'll push the fluid back out. And then generally, and you've had this done as well, they'll put a piece of gauze with a Band-Aid over that. So that was really look at the landmarks. When you come into the skill, you will draw your landmarks, so you need to be proficient in identifying and verbalizing all of your landmarks so we know exactly where you are putting these injections. So again, you would follow all the safety routines, make sure that your patient is in the lowest position, that their call light was in reach. If you've given them any type of a medicine at all, that you're going to be back in 30 to 45 minutes to check on them, or make sure that they are aware that they need to call a nurse if they have any types of difficulties with any of these injections. And I think that basically covers all of your landmarks.